You're welcome back. It's still Nigeria's economy today from Super Screen Television. The COVID-19 pandemic is obviously ravaging the entire world. And there is no solution yet to solving the problem or to finding cure to the pandemic or to even flatten the curve. Looking at Nigeria, what is the pharmaceutical industry in Nigeria doing to reduce the impact of COVID-19 in Nigeria, especially in the area of discovering of new medicine to combat the pandemic? With me in the studio to lead the conversation on the Nigerian pharmaceutical industry and COVID-19 is an astute pharmacist and a businessman. He is the Group Managing Director of the Rees Pharmaceutical Nigeria, Pastor Adesanmi Popoola. Pastor Popoola, you are welcome to the show.
Thank you very much.
Thank you for finding time to join us on today's program. Now, before I go into the questions today, we'd like to inform our viewers that you can join us in today's conversation by calling into the show. The numbers to call are shown on the screen of your television or will be shown on the screen of your television. You can join us by asking questions or by making comments on this particular important topic. Yeah, Pastor Popoola, you are an astute pharmacist. For about, you have about close to 3 decades experience in this job. Now, what is the contributions of the pharmaceutical industry in Nigeria in reducing the impact of COVID-19? You see, the figure keep rising on a daily basis, and we've not been able to flatten the curve. Now, what is the contribution of the pharmaceutical industry to reducing the impact of COVID-19, especially in Nigeria, and looking at the discovery of new medicine to combat COVID-19?
Thank you very much. I'd like to first of all look at it from it's 2 perspectives. What is the pharmaceutical industry in Nigeria doing?
Yes.
And the other one, how to flat. The pharmaceutical industry in Nigeria are doing the best to provide the products or drugs that are needed to help the patients survive the impact of this COVID-19. And this is in terms of drugs that are both curative and drugs that are also preventive. Let's start from the preventive aspect, because the best thing for COVID-19 we can do is to boost our immunity, prevent the impact upon whoever or the populace of this country. And the drugs that are needed are provided all the time, manufactured in Nigeria, the ones that are used to boost the immunity. Because once your immunity is boosted, there's a limit, you have a fighting chance against the infection. And once you have a fighting chance against the infection, the likelihood of you to survive is higher. But once you have the infection, the industry also have products that can help you to survive. Unfortunately, we are yet to discover vaccines for this infection. But they have discovered some products that can be used to treat whoever has been infected. The most common is the remdesivir. It's available, but not easily available in Nigeria. You have to make special arrangement because America has banned the exportation, and India, which is also the next destination for export, have also stopped exporting remdesivir. The other alternative is to go to Bangladesh. And pharmacists are making the effort to get these products in so that whoever needed them can get it from the outlets.
So why can't we produce this particular drug in Nigeria?
It's an high-tech, is a technology that is not available. Nigerian pharmaceutical industry is still at the primary level, where we produce the primary products. When you talk about high-tech products, our products are needed to be produced under high technology. That's not available to us in Africa.
Now, you talked about 2 things here. One is preventive, the other one is curative.
Yeah.
Now, I can go to any hospital now or any pharmaceutical shop and tell them that I want to get some drugs that I can use to prevent COVID-19 from affecting me. Can I do that?
No, you can get drugs that can boost your immunity to ensure that even if you are in close contact with whoever is infected, the impact on you will not be felt.
Okay.
You know, we always say vitamin C is very good. We found out from experience from those that are infected initially that most blacks are lacking vitamin D3 because of our skin color. So if you have access to getting vitamin D3 to be used, it's available in the pharmacy shops. Then zinc is another product that helps to boost your immunity. Once your immunity is boosted, the likelihood of you falling easily to the infection is very low. Because it's an immunity thing. Once the immunity goes low, then there's likelihood for the infection to, it's opportunistic infection. But if you are exposed and your immunity is high, you might not know you are exposed. But if you are exposed and your immunity is low, it comes from you quickly. That's how it works. It's not like cold and catarrh. If your immunity is very high, you might survive it.
Okay. Okay. Now, talking about the curative now, you talk about the fact that it can be prevented by boosting our immunity.
Yeah.
Now, talking about the curative, we have people talk about vaccine on one side, and on the other side, we talk about having medicine that can be used to cure it. I want you to explain the difference between curing COVID-19 and getting the vaccine. So, you know, just you understand what I'm talking about.
The vaccine is to prevent you from catching the virus.
Okay.
It's to fight the virus for you.
Even when the virus comes into you.
Because you have a protection, it's a shield. It's like building a shield around you. It should be a shield around you. In advanced countries, Europe and America, they always take flu jab. They call it flu jab.
Okay.
During the flu season, this is a flu season, they take flu jab. They go to pharmacy shop, they take the jab, and throughout that season, they will not have cold.
It's a vaccine.
It's a vaccine.
Okay.
That's the type of vaccine we are talking about.
So when we have that vaccine, even if the infection comes, the virus comes, it will not affect you.
Yeah.
Now, we keep talking about not having cure for it too. Yet, people go to isolation center, they get cured and they come back home. Tell us about that.
It's not as if people do not have cure for it. Virus must run its course.
Okay.
It's not like bacteria. If it's going to last 7 days, it must run its course. And what it does is to break down your immunity. And if your immunity is not strong enough, it will be broken down, number one. Number two, there are age ranges and infections that predispose you to coming down quickly with the infection. If you're having diabetes, if you're having hypertension, if you're having heart failure, lung diseases, once it comes in, it breaks down your system. The organs will be attacked by the virus. They quickly multiply themselves inside the body, and they attack everywhere. And once they attack everywhere, once they attack your lungs, you start having problem of pneumonia. And it's a viral pneumonia. And once they attack the lung, you cannot bring in the oxygen again. So what the pharmaceutical industry could do is to ensure that you have enough products to stop this virus from multiplying. From multiplying, number one. Also, to give your body a fighting chance. Once your body has a fighting chance, you can suppress the virus.
Okay, that is what they apply at the isolation center.
The isolation center is to ensure that, number one, you are separated.
Okay.
Then they can give you a focused treatment. They give you the vitamin C, they give you the zinc, they give you the vitamin D. If you don't give vitamin D, they take you out in the sun to go and get more vitamin D. Unfortunately, most of us in this side of the world, once you are able to have some money, you are always in the aircon, you are hardly in the sun, and these are areas you can get vitamin D. The food that gives vitamin D, some of us don't take them.
Okay, still talking about this particular high-tech drug that you said we can get from India and some other places.
Remdesivir.
Exactly. What is the industry doing to make sure that we have it in Nigeria?
What we are doing is to collaborate with some manufacturing companies.
Okay.
I always say that once a problem comes, it is too late to prepare. let me turn it around.
All right.
Once an opportunity comes, it's too late to prepare for that opportunity. It's an opportunity we are having, but it takes minimum of 6 to 18 months to develop some products, including remdesivir.
That's about 2 years.
Yes. Then also it takes so long to set up a factory that will manufacture it. Because those equipment must be manufactured specifically for that process.
Okay.
So once the problem is there, then you need to do a catch-up.
Okay, like it is being said, in every challenges,
Yeah.
if you look at the other side, there are opportunities.
Yeah.
So I want to agree with you that there is opportunity for Nigerian pharmaceutical industry now to also develop this drug and some other ones, as the case may be, right?
Yeah.
Now, let's talk about CBN, Central Bank of Nigeria's intervention. CBN has been assisting some industries, and the pharmaceutical industry is not an exemption. I was made to understand that there is this particular CBN intervention fund to assist the pharmaceutical industry. Can you tell us a little bit about that?
Well, I want to thank the federal government and the CBN for giving the pharma industry opportunity to get back on their tracks. Because the challenge we are having is liquidity. The challenge of liquidity has really suppressed the progress and the growth of our industry in Nigeria. Because the cost of funds, the interest rate from the commercial banks does not make pharmaceutical business profitable. Because by the time they ask you to pay 22% on product that you cannot charge more than 25%, how much do you have to run the business? So we found out the cost of fund is very high. Now the government is giving us a single digit intervention fund. For those that have gotten it, it helps them to increase their capacity.
Okay.
It helps them to start developing new brands.
Okay.
It helps them to start going to research.
Okay.
And it even helps them to go to vaccine production and development. These are things they cannot do with high
Interest rates.
fund. Why? Because, like I told you, the gestational period for those things are very long. And if you put money that is a short term into a long term business, you run into problem.
Wow. So, in a short, the pharmaceutical industry in Nigeria is benefiting from the intervention of CBN.
Those that have accessed it are benefiting. But there are so many that have not accessed it, and I hope very soon everyone will be able to access it.
Okay. We are enjoying this. We will be going on a short break. When we come back, we will continue with Pastor Adesanmi Popoola on the conversation. Stay with us, don't go away. We'll be right back.
Trader.
I am Edward, sir.
Patronize me because I put a lot of uniqueness to my craft.
Me, I the sew cloth.
My shop is at Onikpan.
I am a photographer.
And I am a shoemaker.
Me self, Abibaba.
In 1 minute, sell yourself, sell your business, and your crafts and your services to the world on the Super Breakfast Show, showing on Super Screen Television every last Saturday of the month from 9 a.m. to 10 a.m. Don't forget to include your phone numbers and your business address. Selling made easy.
You're welcome back to Nigerian's Economy Today, and thanks for joining us. I still have Pastor Adesanmi Popoola in the studio. shedding lights on the pharmaceutical industry and COVID-19 in Nigeria. We have been enjoying the discussion by the pharmacist, Pastor Popoola. Now, Pastor Popoola, sometimes ago, we heard that apart from using the normal medicine that we know, that there is possibility of using herbs to combat COVID-19. And we had the instance from a particular country in Africa, Madagascar, that says that they have a cure for COVID-19. And there was a point in time that we even imported some of these herbs to use in Nigeria. And some people that have gone into that have been infected with COVID-19 have come out to tell us that, look, I use herbs and it has worked for me. As a pharmacist, I want you to comment on this. Comment on the herbs from Madagascar and some people that have been saying that they use herbs in combating COVID-19 in Nigeria.
Thank you very much. Let me start from Madagascar adventure. Let me call it adventure. What is inside the Madagascar COVID-19 therapy is just anti-malaria, artemisinin powder, plus ginger, plus garlic, and one other product, maybe neem. These are all towards fighting malaria and boosting immunity. And once they have a good marketer in form of their president became a marketer. Honestly, he's a good marketer. He marketed it to all African countries. And they started buying it thinking that it's a COVID product. COVID-19 is a new virus. It has never come before. Suddenly someone said he got an herbal product that can cure it and he's marketed it through Africa. And all African countries are buying in dollars. But locally, we have people who can also give us immunity boosting drugs. What they have is that once the infection attacks, you need to boost the immunity of the person. If someone is having malaria and the COVID-19, coronavirus comes into that body, it breaks down everything. But once the malaria is taken off, he has a fighting chance to fight the infection. So what he does is that they made an error and claimed that it can cure COVID-19. Let everybody go back to their work. Once you drink the herbal mixture, you are okay. Now they have locked down their country. More people are dying there than any other country now. Because they took chance, thinking that their herbal mixture is a cure. We are still working on solution to COVID-19. And everybody has to be very careful. Nigeria also have some herbal products and help us to boost our immunity.
That's what I want to talk about.
And give us fighting chance. Underline fighting chance to fight the infection. Because it's a viral infection that must run its course. Once you survive and your lungs and vital organs are not affected, you come out of it in a few days. But you need your immunity to fight it. Since now you are not discovered a perfect cure for it. The word perfect underline.
I understand. Now, let's talk about what the federal government is doing. You know, what can the federal government do differently, especially in the fight against COVID-19, especially in the areas of supporting people that are on the front line? Federal government have made promises to people on the front line, especially in the areas of their welfare package. Now, what can the federal government do differently to still continue to encourage people that are on the front line?
Well, the federal government has good intention, but the implementer of the policy are the problems. They are Nigerians. And when monies are deployed to certain things, it must go through some filters. And it depends on how those filters are handling the money that make it to get to the end those that need the money. Agreed. Federal government deploy a lot of money. Some agencies, some NGOs, some goodwill individuals, they've given money. But those money are not getting to the front line. The doctors, the pharmacists, they are the frontliners.
Exactly.
They need to be given their allowances. They need to be encouraged. And what is happening? These monies are not coming in 2 months. They are not coming, number one. Number two, they need protection equipment, PPEs. Once the PPE is not there, they easily get infected. They also become patients instead of treating patients. And the more of them that become patients, the less of them you have to treat patients.
Wow.
And that's the challenge. Number one, encouragement should increase. Federal government should also do a proper survey to ensure that the money that are being given out gets to the people that are meant for. So that's what is happening in Nigeria. It leaves the money, it doesn't get to the people that should be paid until they go on strike. Now they will now pay them. What is the money doing in those accounts? We need to look at the processes and procedures of releasing money and to get to the final target. And we need to make examples of some people. Once the money is released, it has to be released, paid to whoever should be paid. It discourages people from doing the right thing. Then the PPEs are not available. Who is keeping the money for PPEs? They are available in the private market. Why are they not available in government hospitals? Because without the personal protection equipment, the people easily get infected. So those are the challenges, and government should buy more personal protective equipment. They should buy all the garments and everything that needed to be done, to be bought.
Okay, having said that, do you have words of encouragement for those in the value chain of the pharmaceutical industry in Nigeria?
Well, my words of encouragement for those in the value chain, number one, COVID-19 presented an opportunity. They always said crisis in Chinese is written in 2 words, danger and opportunity. So COVID-19 presents a good opportunity for the industry to retool and get back on their tracks. One of the opportunities that provided is that for the first time, government is looking at the industry for special mention and for special attention.
Yeah.
That means it's an opportunity. Number two, all the things that are needed to prevent and to cure COVID-19 has to be supplied through the pharmaceutical chain, value chain. So it's an opportunity for increasing business. So what they just need to do is to ensure that they look at their cash conversion cycle.
Okay.
Make sure that you go into things that brings your money back quickly. Avoid projects that will tie down your money for longer than necessary.
Okay.
It's very important. You avoid it. Product that will then adapt quickly. You know, it is said that the animals that survive most are not the swiftest or the smartest, but those that can adapt to change.
Sure.
So, as in the pharmaceutical value chain, we need to look at what are our brand, our products. Are they relevant to today? Most of the time, our reps, our salespeople cannot go to hospital now because of the likelihood of COVID-19. So what are you doing to ensure that you get to those doctors? You deploy technology. Deploy Zoom technology. There are a lot of technology you can deploy today to monitor and to get your products to the customer, to the end users. I would advise that we invest more in technology in the value chain. Once we invest more in technology, we'll get it's even cheaper. Technology is cheaper than physical travels. These are areas that we can look into.
Okay.
Then also, well, these are challenges we have in the industry. Most of the federal government institutions are not paying. They are refusing to pay because of what I call general malaise of mismanagement. Most of the federal government hospitals have been mismanaged. So they will buy the products, keep the money, and once you stop supplying, they go to another person that wants to supply. They take from that company, and in the end, they use the money of the new man to pay the old man to pay the new person.
And before I wrap up on this, there is a final question. We know of the COVID-19 protocols. We know of the personal hygienes that they have asked us to be doing in order to prevent this. In your own opinion, what do you think can be done to flatten the curve?
Number one, everybody should wear a mask.
Everybody should wear a mask.
once we wear mask, the likelihood is reduced. You know, there's this diagram that shows the percentages of the likelihood of infection when mask is worn. If I wear mask, you are not wearing mask, it's higher. If you wear mask and I wear mask, it's lower.
Okay.
So if everybody wear mask, we are likely to flatten it. In countries that have decided to flatten it, they adhere strictly to wear mask wearing. Look at what's happening in America today. It's rising because they believe that mask is against their constitutional human rights. Their government is forcing them to do what they don't want to do. But most of them are now catching COVID-19. So number one, everyone should wear masks. Number two, we should try and do this social distancing a lot. If you cannot social distance, for example, we are social distancing now.
Sure.
Wear your mask.
It's been very interesting speaking with Pastor Popoola on COVID-19 and the pharmaceutical industry in Nigeria. And the last word, that is, wear your mask to prevent COVID-19. We want to thank you very much, Pastor Popoola, for finding time to come on this show.
Thank you very much.
Still to come, COVID-19 and the industrial sector in Nigeria. Please don't go away. We'll be right back.